Electrocardiographic changes in hypothermia. The definition is that hypothermia is defined as a body temperature less than 35 degrees Celsius and also has an influence of a condition of the heart. It has been described abnormalities during the therapeutic hypothermia that may be indicative of cardiac ischemia, particularly ST segment elevation of myocardial infarction. Now I have a video.
In this lecture, we will discuss the EKG changes that can be seen in hypothermia. Hypothermia can produce several EKG changes as an individual's body temperature drops below 30 degrees Celsius. First, everything slows down at cooler temperatures. Sinus bradycardia is common in all the segments and intervals, including PR, QRS, and QT, may become prolonged. It's as if the cardiac cycle is now being stretched out. So again, first thing, everything slows down. Second, a distinctive and virtually diagnostic type of ST segment elevation can be seen. It consists of an abrupt ascent at the J point and then sudden drop back to baseline. This is called a J wave or Osborn wave. So our second and most helpful that we'll see is this J wave or Osborn wave. And we can see that here in this example on the top right. This is the Osborn wave, right? What we're saying is that it's just this pretty much diagnostic, and something you'll see in hypothermia is the ST segment elevation. We have the abrupt ascent at the J point. So this point right there is our J point, right? So it goes up and then it drops back down to baseline. Okay, and we call that a J wave, so that at the J point, we can get a J wave. And it's also known as an Osborn wave, right? And if you see that, that is almost diagnostic for hypothermia. In addition, various arrhythmias may occur in hypothermia. The most common one is a slow AFib. Okay, a slow AFib is the most common one in hypothermia. The last EKG change you may see is a muscle tremor artifact from the patient shivering because he or she is so cold, right? And we see that here in this bottom rhythm strip. You can see these waves going up. These are the artifact from the patient shivering because they're so cold. A similar artifact can be seen in patients with Parkinson's disease because they have a resting tremor. Now make sure not to confuse these artifacts with a flutter, right? You kind of almost see, you may think of these as a flutter, and is really not, right? So make sure that if the person's hypothermic, right, temperature below 30 degrees Celsius, around that, and you see this wave, it is not likely a flutter, but more likely a muscle tremor artifact. See if the patient's shaking a little. Well, that's it for this lecture. It's a short and simple one. Be sure to look out for those J waves or Osborn waves if your patient's temperature starts to fall, right? Especially below that 30 degrees Celsius.
Now, as an applications in medicine, hypothermia induces an increase in the activity of a cardiac transit outward potassium current, which is more prominent in the epicardium than in the endocardium. This is a heterogeneous distribution of potassium current results in G waves that are typically observed in the inferior lateral precordial leads, as seen in this patient. The magnitude of the G waves may generally be associated with the degree of hypothermia. Then we have another video.
This here, one of the questions asked in ECG was changes in hypothermia. So let's look at the changes via the question which was asked. So the question was asked: in early December, a middle-aged man found lying in the park. He is surrounded by bottles of wine, has a GCS of 9, and ECG is performed in the ambulance. What is the diagnosis? And the options were this. So obviously, there are certain things which we are looking. there is a bradycardia, severe bradycardia, 1, 2, 3, 4, 5. So if you divide 300 by 5, so the beat would be 60 per minute, or even more, less than 60, around 50 per minute is the beat. One characteristic thing which you find is that this is QRS. Just after the QRS, there is a slight negative deflection, and then you have a T wave, and then you see. And the same when it is positive, there is a, after QRS there is a slight positive. Right? You see these waves? These are J waves or Osborn waves, and these are characteristically found in hypothermia as well as hypercalcemia. So in this case, the diagnosis will be hypothermia. Let's look at some of the other findings in case of hypothermia. So in hypothermia, the ECG would be marked by bradyarrhythmias and Osborn waves, that is the J waves. These is characteristics, and also you can find prolonged PR, QRS interval, ST interval. So this is T wave. You can see there is a huge prolongation of QT interval, right? And so this is the P wave. Again, you can find the PR interval is increased. So also if there is a huge hypothermia, you can find shivering artifacts. In this you are not seeing shivering artifacts, but you can see shivering artifacts. So this is a typical ECG of hypothermia, where you see the Q waves, the J waves. This is the J wave, a slight, positive deflection. So in the case of V1 or V2, the deflection would be towards the negative.
So the pros and the cons are that it has characteristic pattern in the ECG known as Osborn waves or G waves, which help us differentiate from other heart disease. And the cons is that it can cause prolonged QRS, causes bradyarrhythmia and elevation of the ST segment, which can mimic an acute myocardial infarction, leading to an incorrect therapy.
Alright, hypothermia. What is hypothermia? Hypothermia occurs when the body passes below 95 degrees Fahrenheit, okay? So just as important as 100.3 is to fever, 95 degrees Fahrenheit or 35 degrees centigrade is important to hypothermia. One quick reminder, check blood glucose in all your hypothermia patients. Don't forget this one. It's equally possible that they became hypoglycemic after becoming hypothermic as it is possible that they became hypoglycemic and fell out in the cold and then became hypothermic. So what do we see on the ECG? We will see bradyarrhythmias. The key word in that sentence is brady. Alright, things get slow when they get cold in the human body. We can see new onset AFib, but it usually won't be AFib with RVR. This will be AFib with a very slow ventricular response because the ventricles are having trouble exchanging the chemicals that they need to make things happen. We see sinus brady. We see ST segment changes as well. I'm going to show you an ECG at the end of this presentation that mimics a STEMI pretty well. We also see Osborn waves, or what are commonly called J waves. Now, on a real quick note, we tend to get tied down to pictography or to morphology. Just understand, Osborn waves are not called J waves because they resemble a J. They're called a J wave because they come up at the J point. They arise at the J point. They actually come closer to resembling an RSR pattern in some patients than they do the actual letter J. So just sort of take that into account. So traditional knowledge on J waves is they're directly proportional to the severity of the hypothermia. So as you can see in the chart on the right hand side of the screen, you've got some very high J waves at admission. Those temperatures are in centigrade, but you can do the math. And as the patient gets better, the J waves get smaller until they are gone. Okay, and then when the person hits normal body temperature, they're completely gone. So here is a better example of a J wave on this next slide that are a little bit smaller and maybe something we're more likely to see if we get there earlier. All right. So let's have a look at this ECG. And this is a pretty classic hypothermia ECG. I know it's old and a bit grainy, but this is one that's just a really, really good example. You can see the Osborn waves, they're prevalent. You also can see this huge amount of artifact in the ECG, and where do you guys think that's coming from? That's right, it's coming from shivering. So when your patient is conscious, expect to get an ECG where somebody is shivering, where everything doesn't always look so great, all right? So let's have a look at this next one and take a minute and decide what you see here. So this is one of those ECGs that the life pack's going to say, hey, meet STEMI criteria, you know, that kind of thing, because that's all it's able to really look at. But if you look at it closely, you can see the morphology here, and you can understand that this is not a STEMI at all, right? It's got some of the ugly morphology that we talked about in the BER video, but this is actually a bradycardic rhythm from someone who is hypothermic, and they do not appear to be doing a lot of shivering, so this will be in severe hypothermia, all right? All right, guys, that's about it. So tell me what else you want to learn in the comments below, and have a good one.
So elevation is very important, but because we're located in a tropical zone in the middle of a world where we have temperatures no less than 18 degrees, cases of severe hypothermia and its repercussions in the heart are limited or almost unknown. And as a conclusion, hypothermia, as we know, when the body temperature is less than 35 degrees, can affect the heart's rhythm, in which the most common arrhythmia is atrial fibrillation and elevation FT segment, which can imitate a myocardial infarction or turn into one. Thank you.